The grant received from the Gates Foundation enabled the department, in partnership with the City of Cape Town Health and the Health Foundation, to look at ways of utilizing data and digital innovation to enhance patient care. From the outset, we knew this would be an exciting yet challenging endeavor, predominantly due to the complexity of the health system and the relative different maturity levels of the data systems and the tools that were actually available to us at the time.
From the Department of Health and Wellness side, we had 4 sectors that were in fact involved in implementing the grant. So those were the Metro Health Services, Rural Health Services, our Provincial Health Data Centre, as well as the Emergency and Clinical Services support teams. And together, all of us implemented the grant in the Western Cape Province.
The ultimate objectives of the grant can be summarized quite simply. We wanted to find clients with HIV and TB, treat them, link them to care, and retain them in care. Finding meant precision identification of individuals and testing for HIV and TB. Linkage to care was especially important for those diagnosed in hospital. And then creating treatment and retention platforms that were appropriate for the communities and the clients that we've seen. Grant gave us the resources to appropriately use data and develop these tools and implement them within the operational areas to ultimately achieve the goals as described.
One of the biggest lessons is around using the reports, and also what we've learned to how to engage data, how to complement your clinic visits and support visits. So that is really a lesson I will really take. And I can also do this at the introduction, when we have induction and orientation with new staff, how we can use data, the importance of data in decision making. It's not only a tick exercise, but it's a client, it's a patient, it's someone's life. It goes up to our CFO in terms of treasury and budget management. So the 3 C's is important for data management. It must be correct, complete, and consistent, so that we can make decisions and trust the data. We've gained so much knowledge and support, and the nice thing about this is sustainable. I went to a clinic and I saw a TB nurse use it and how easy it is to use. And before this project, we were struggling with tools and reports and M&E monitoring, but it's really a great tools. We've been empowered. There's a lot of great things we can take forward from this project.
And for me, just to share today, there are 2 main impacts that I think the grant made that is really important. And the one was the development of the Learning Health System framework, and the other was the embedding of a culture of quality improvement. Data and data tools alone does not help people to learn and change. And we know from high income countries that they focus a lot on that. But in our setting, it is important to focus on people and the organizational aspects. And if you strengthen those, you can actually support learning. And so ultimately, what happens is that these organizational structures become sacred spaces of learning and of improvement. And ultimately, it empowers people and it empowers teams to continue with learning, growing, and improving the health system as a whole.
So the Provincial Health Data Centre had to harmonize, curate, beneficiate the health data, while also ensuring that actionable reports such as the TB and HIV treatment action list and dashboards were developed. So the objective throughout this initiative was really to place the right information in the right hands at the right time, so that appropriate decisions and actions were actually taken for the benefit of the patients that we serve.
And if I look at the areas in which the grant focused on, the following really was where we had put our effort and attention on in terms of TB testing, which included the targeted universal TB testing. but also in fact it was trying to link people diagnosed with TB at hospital and primary care level into care. We found that our loss of follow-up and loss to care rates are actually very high in the Western Cape province, and the grant enabled us to link people directly to care.
I think one of the key successes of the grant was not just scaling the use of the data tools and the achievements we made in the objectives as described, but the cross-collaboration platforms that were established across the health system, something that I think will be a lasting legacy that comes out of the data scaling grant.
We are also able to strengthen the health system, and ultimately that will have a significant impact on how we provide care to people in the Western Cape province. We are also able to utilize our tools, the data system strengthening, and those lessons that we've documented. That will help us significantly build a very strong foundation of how we provide clinical care to people in the Western Cape province.